Hello everyone, myself Dr. Velmurugan Mannar. I am a specialist endocrinologist in Aster Clinics. So today we're going to discuss an important topic about insulins. Okay, what are the myths and facts that people should know? So first we'll discuss what is insulin. Insulin is an hormone which is produced by pancreas. There are cells called as beta cells which produces insulin, and the main function of this insulin hormone is to control the blood sugar levels. Now we'll just extend this further and learn what is the link between diabetes and insulin. Yeah, I think everyone would have heard about diabetes. Either some may be suffering from that, and some may have relatives who are suffering from diabetes. So what is happening in diabetes is there is a problem in the action of these insulin hormones. There are two types of diabetes. Everyone would have again heard about that. Type 1 diabetes, which occurs predominantly in children, where the beta cells are destroyed, so the individual does not have insulin at the adequate level to control the blood sugar levels. Whereas in type 2 diabetes, which occurs in elderly population, especially people who are obese, so here the insulin is produced to some extent from the beta cells, but there is a problem in the action of insulin. Okay, so the thing that we have to understand is in diabetes there is problem in either the secretion of insulin or action of insulin. Now we'll come to the most important aspects that people want to know when doctor uses insulin for treatment of diabetes. Yes, if we just see in type 1 diabetes, especially which occurs in children, the only treatment that works well or only the treatment which is approved is insulin. So every patient with type 1 diabetes will be on insulin. But whereas for type 2 diabetes, doctors tend to prescribe insulin when the sugars are not controlled with existing oral medications, or when the patient has developed any other illness for which patient has got admitted in the hospital. So these are the situations in type 2 diabetes we tend to use insulin. And another important situation is diabetes which occurs in pregnancy. Again, the most important drug that we use here is insulin, because this insulin is perfectly safe for both mother and baby. Now if we just go through the social media and other platforms, there are certain materials which are circulating about insulin. We'll just see two important things that many people want to know about insulin, right? One is, if a doctor starts a patient on insulin, especially in type 2 diabetic patient, whether that insulin has to be continued lifelong. The answer is no. So most of the times doctor tend to start insulin to control the blood sugar levels, but few of that patient on subsequent follow-up can be free of insulin. And another important query is, does insulin causes kidney failure or any other health element, or in other words, whether the insulin treatment itself harmful? The answer is again a big no. Insulin does not cause harm to your body, and in fact it is the safest mode of treating diabetes in pregnancy or in diabetic individuals who has developed renal failure or other comorbid illness. With this, we'll conclude today's discussion. I hope we'll see you again with another interesting facts in endocrine disorders. Thank you.